China is also working to reform its healthcare system by making drugs cheaper and boosting the pay of doctors. At a news conference in Beijing on Thursday, officials from the National Health Commission talked about how the government aims to achieve its targets in 2021. Liu Jiaxin has more details.
An expensive medical bill can include the cost of a doctor's diagnosis, medical supplies, and drugs. In order to reduce the financial burden on patients, China is looking at ways to lower the latter two and increase treatment fees for doctors. It's an idea that's now being put into practice. Sanming is in southern China's Fujian province and introduced such reforms in 2012. 9 years later, the city's success means it's being replicated in public hospitals across 11 provinces.
进一步推广三明市医改经验。
We should promote Sanming's experience in medical reforms and centralize the procurement of drugs and consumables. 80% of the reduced prices will be used to increase the price of expertise, which will be covered by medical insurance and will not increase the burden on people.
In addition to limiting unnecessary drugs and companies suspected of racking in high kickbacks, Sanming's experience also includes cutting costs in distribution and supply chains that have traditionally raised the drug prices. That means compensation for doctors no longer needs to be dependent on the price of drugs and consumables, but is directly linked to their expertise. Officials say the medical reforms aim to let the public hospitals to better serve the people and to encourage the doctors to focus on their patients. Strengthening the regulation of drugs will certainly impact some of the interests of the business, but this is on the government's must-do list. Liu Jiaxin, CGTN, Beijing.